Good evening, guys. Tonight's discussion A is discussing 5 breakthroughs that changed medicine. So here we go with the presentation I made for you. Please enjoy. Okay, title 5 breakthroughs that changed medicine. From Med School Insiders. Highlights pivotal moments in medical history that revolutionized healthcare. Here's a concise summary of the key points. Main breakthroughs in medicine: hand washing and hygiene practices. There was a time when physicians didn't wash their hands between procedures like autopsies and childbirth. The adoption of hygiene practices dramatically reduced infections and mortality rates. Germ theory of disease. Replaced outdated beliefs like bad smells causing illness. Reduced the understanding that microorganisms are responsible for many diseases. Vaccination. Once controversial, now foundational to public health. Scientific backing and widespread use have saved millions of lives. Antibiotics transformed the treatment of bacterial infections, marked a turning point in survival rates and surgical safety. Medical education reform. Shifted from anecdotal learning to evidence-based scientific training. Modern med students now learn through rigorous research-backed criteria. These breakthroughs not only reshaped clinical practices, but also laid the groundwork for today's evidence-based medicine. If you'd like, I can help you explore how these shifts intersect with culturally responsive care or toolkits development, especially in aging or cognitive health contexts. Let's bring each of those 5 medical breakthroughs to life with real world examples that show their transformative impact. Okay, guys. Next page. hand washing and hygiene practices. Example. See. Okay. So, some as well notice that women in maternity wards attended by doctors had higher mortality rates than those attended by midwives. He traced the cause to doctors performing autopsies and then delivering babies without washing hands. After instituting hand washing with chlorinized lime, mortality rates dropped dramatically. Through his idea were initially rejected. 2. Germ theory of disease. Louis Pasteur's experiments in the Pasteur disproved the theory of spontaneous generation and showed that microorganisms cause fermentation and disease. Okay. His work laid the foundation for sterilization, pasteurization, and modern microbiology. Robert Koch later built on this by identifying specific pathogens like the tuberculosis bacteria. Okay, vaccination. Example, Edward Jenner's smallpox vaccine, 1796. Jenner discovered that milkmaids who had contracted cowpox didn't get smallpox. He inoculated a boy with cowpox and later exposed him to smallpox. He didn't get sick. This breakthrough led to the global and education of smallpox in 1980. Antibiotics, that's number 4, guys. Example, Alexander Fleming's discovery of penicillin in 1928. Fleming noticed that mold penicillium killed surrounding bacteria in a petri dish. Penicillin became the first widely used antibiotic, revolutionizing treatment for infections like pneumonia, syphilis, and strep throat. It saved countless lives during World War II and remains a cornerstone of modern medicine. Medical education reform. Example, Flexner's report of 1910. Abraham Flexner evaluated medical schools across the U.S. and Canada, exposing poor standards and lack of scientific rigor. His report led to the closure of substandard schools and the rise of university affiliated research-based medical education. It standardized curricula and emphasized laboratory science and clinical training. If you'd like, we can explore how these breakthroughs have or haven't been equitably implemented across different communities, or how they inform culturally responsive toolkits for aging and cognitive health. Want to co-design something around that? Each of these 5 medical breakthroughs continues to shape modern healthcare in profound ways, clinically, socially, and even politically. Let's unpack their implications through a systems lens. Hand washing and hygiene practices, modern implications. Infection control protocols standardized across hospitals, clinics, and even home care settings. Global health campaigns, World Health Organization, clean care, and a safer care initiative promotes hand hygiene worldwide. Behavioral science integration, nudges, and signage in public spaces, e.g., airports, schools, reinforces hygiene habits. Equity lens, disparities in access to clean water and sanitation still affect infection rates in marginalized communities. Germ theory of disease, modern implications. Foundation of public health drives policies on food safety, sanitation, and outbreak response. antimicrobial stewardship informs responsible antibiotic use to combat resistance. Cultural adaptation needs misconceptions about disease uh, causation persists in some communities. Myth busting remains vital. Pandemic preparedness. COVID-19 reaffirmed the importance of microbial microbial surveillance and education. Vaccination modern implications. Preventative medicine backbone from childhood immunizations to Hep V and shingles vaccines. Digital outreach and trust building, combating vaccine hesitancy through culturally tailored messaging. Global equity challenges uneven distribution of vaccines, e.g., COVID-19 highlights infrastructure and policy gaps. Community co-design, engaging elders and caregivers in vaccine education improves uptake in underserved populations. Okay, antibiotics, modern implications. Give me 1 second, guys. Antibiotic resistance crisis. Overuse has led to superbug requiring new stewardship models. Precision medicine, geometric tools help tailor antibiotic choices to individual patients. Access disparities. Rural and low-income areas may lack timely access to effective antibiotics. Toolkit integration. Caregiver guidelines now include antibiotic safety and resistance education. 5 medical education reform. Modern implications. Evidence-based practices. Clinical decisions are now data-driven and peer-reviewed. Culturally competency training curricula increasingly include models on bias, equity, and community engagement. Interdisciplinary collaboration. Medicine intersects with social work, policy, and tech, especially in aging and cognitive health. Participatory learning models Community-based education and storytelling are gaining traction in elder care training. Would you like to co-create a framework that maps these implications to aging interventions or caregiving toolkits? We could even build a matrix that evaluates how well each breakthrough has been adapted for culturally diverse communities. Let's detail the most significant impacts these 5 medical breakthroughs have had on patient care through both clinical and equity lenses. Okay. Number 1, hand washing and hygiene. Impact on patient care. Reduced hospitalization, hospital acquired infections. Okay. Hand hygiene protocols dramatically lowered infection rates in surgical wards, ICUs, and elder care settings. Improve maternal and infant outcomes, especially in lower resource settings. Hygiene practices save lives during childbirth. Empowered caregivers, training families, caregivers, and hygiene reduces transmission in home-based care. Germ theory of disease, impact on patient care. Accurate diagnosis and treatment. Understanding pathogens enables targeted therapies and reduces misdiagnosis. Informed public health measures. Quarantine, sedation, and outbreak containment are now evidence-based. Culturally sensitive education, myth busting around disease causation improves trust and adherence in diverse communities. Vaccination impact on patient care. Preventative care as standard. Patients now receive routine immunization that prevent debilitating illnesses. Community immunity protects vulnerable populations, including elders and immunocompromised individuals. Patient-centered outreach, tailored messaging increases vaccine uptake in hesitant or underserved groups. Antibiotics, impact on patient care. Life-saving interventions treats infections that were once fatal, enabling safer surgeries and cancer treatment. Chronic disease management prevents complications in conditions like diabetes and COPD. Resistance awareness. Patients are now educated about completing courses and avoiding misuse. 5. Medical education reform impact on patient care. Evidence-based practices. Patients benefit from treatments grounded in rigorous science. Culturally compliant care. Providers trained in bias and equity deliver more respectful, personalized care. Collaborative models. Interdisciplinary teams, e.g., social workers, nurses, community health workers, and improved outcomes, especially in aging and cognitive health. We can build a virtual matrix that maps these impacts across different care settings, rural clinics, elder homes, urban hospitals, and identify where culturally responsive adaptations are most needed. Want to sketch that out together? The ripple effects of those 5 medical breakthroughs on healthcare policy are profound, especially when viewed through a systems and equity lens. Let's break down the key implications across each domain. Hand washing and hygiene policy implications. Mandatory infection control standards. Federal and state regulations now require hygiene protocols in hospitals, nursing homes, and outpatient clinics. Funding for sanitation infrastructure, especially in rural, underserved areas. Policies support access to clean water and hygiene supplies. Workforce training mandates, policies, and incentivize caregiver and home health aid training in hygiene practices. Germ theory of disease policy implications. Evidence-based public health laws. Quarantine setting, sanitation, and outbreak response protocols are now codified in law. Surveillance systems. Investment in microbial tracking, e.g., CDC National Notifiable Disease Surveillance System. Health literacy and campaigns. Policies fund culturally tailored education to dispel myths and improve disease understanding. Okay, guys, so that is it for tonight. I will see everybody Tuesday for shows. Everybody have a good Labor Day tomorrow, please. And I will see you guys on Tuesday. For now, Gator Wellness, take care, folks. Have a good evening.